Hi my dear doctors, today we are going to discuss about the pelvic shape of female. Okay, so the pelvic shape of the female has a very great importance during delivery. So our delivery also depend upon the pelvic shape of the pregnant lady. So depending upon the shape, we say that it should be normal and it will have some complication, or there should be some cesarean sections. So there are four type of the pelvic cavity shape. There is number first one is gynecoid. Gynecoid is the classical female pelvis with the inlet transversely oblique and the romier pelvic cavity. So as they said, that is it is transversely oval and a romic pelvic cavity. So it is a very favorable shape of the pelvic cavity, and mostly 50% of the ladies, they have this shape of the pelvic cavity, and it is very favorable for the normal delivery. So we can see here. So this is what the gynecoid. It is transversely oblique, okay, and the outlet is wide, and the angle is a little bit not so wide, but it inside that is the, we can see the canal is wide, and it helpful in and normal delivery. So 50% patient have this. What about the another one, that is anthropoid? Anthropoid is a very a long, narrow and oval shaped pelvis due to the assimilation of the sacral body to the fifth vertebral body. In this condition, the you can see here the anthropoid, it is oval shape. Planoid is oval shape, but it is transversely oval, but it is vertically oval. Okay, it is oval shape and it is narrow. You can see here it is a narrow. Then thereafter glenoid is wide and it has a narrow opening or narrow pathway. And what about the angle of the pubic arch? The angle is wider than that of the glenoid. See here the ischial tuberosa, they are wide and the angle is wide, and it is 25% of lady they have this. So another one, that is the android. The inlet is heart shape and the cavity is funnel shape with a contracted outlet. So android, here we can see it is the heart shape, and again if you compare these three, so the widest in the area is gynecoid, then a little bit smaller that of anthropoid, then a very small and very narrow, that is the android. So android is a very small and very thin in the funnel shape canal. And what about the platypulite? Platypulite, a wide pelvis flattened at the brim with the sacral promontory pushes forward. So it is very rare condition. See, the pelvic is oval, the pelvic inlet is flat, and the pelvic outlet is white, and the pelvic arch is also white, flat. So the most common one is gynecoid, and very favorable is platypulite, and after that gynecoid. So this is about that of the pelvic shapes.